healthcare dynamic is rapidly changing. Understanding the basic fundamentals related to the business of medicine empowers practitioners to advance their skills in and knowledge of the business aspects of medicine. SMA's Business of Medicine Simplified program explores the essentials of everything from reimbursement and compensation models, insurance and risk management, to practice employment and business finance. Today, we are joined by Roz Lindsay, who will be discussing healthcare management and leadership. Over her career, Roz has been a veterinarian, healthcare leader, and business owner. Her most recent venture is dedicated to providing healthcare managers with easy access to management and leadership development. Engage Your Healthcare Leadership supports managers with online courses, resources, and community. Thank you so much for joining us today, Roz.
Thanks for having me along, Jennifer. I'm really delighted to be here speaking with you today.
What do you see as the biggest challenges in healthcare management and leadership today?
Well, I'm not going to say all of those tough things that you have to do, because I could list off things that healthcare leaders have to do every day, the actions, the activities. I'm going to focus a bit more on the big picture challenges. I think one of the biggest things that I see when I work with healthcare managers and leaders is them having the time or the energy to develop their management and leadership skills in the first place. A lot of healthcare leaders tend to be thrown into a management role, often because they've worked somewhere for a period of time or they're really keen to progress, but they're often not given a lot of development in terms of what does it mean to be a manager or a leader, and what are the skills that you really need to develop. Now, inherently, some people have those skills, yet I think the biggest challenge for most is not knowing what you don't know. So being able to find the time, knowing where to get that practical skill development, and having that commitment to make it a priority, because it is very busy when you become a manager in healthcare. I think the second thing for me is finding a network to learn and share with. So healthcare management in some areas can be really isolating. And where do you find support? Someone that you can safely talk to, that you can bounce around ideas, ask questions, share your thoughts, or even just celebrate your success. Sometimes it's hard to find that network. And if you don't have that network, you can feel, I guess, a bit vulnerable when you're doing things that might be the first time around in terms of management and development.
And I bet it's also,
and I think
oh, go ahead.
You go.
Oh, I was just going to say, and I bet it's also an opportunity for you to share experiences or to reach out to others who may be in a situation that you're in where you don't have experience, but maybe they do, and you can draw upon your colleagues' experiences and knowledge.
Absolutely. I think that can be really challenging. And even if let's say we're working in a hospital system and we know that there are other managers around us, sometimes though, even if they are physically there, we don't want to open up and be vulnerable to say, hey, do you know what? I don't know how to do this, or I've never done this before. Or if it's a competitive type culture, we actually don't want to show that we don't know something. So sometimes we're isolated geographically and physically from other managers, as you say, because, just to ask ideas and share thoughts. Sometimes even if they're there physically, we're isolated because of our own mindset and being a bit fearful, I guess, to put ourselves out there as a bit vulnerable. So I think probably then the third thing that I think is a bit challenging in healthcare management is that fast-paced, forever-changing environment that we work in. So it's dealing every day with all the things that have an impact on your team's performance. And a lot of those things may be out of your control. A lot of those things might be a policy or a procedure or a government initiative, whatever the case may be. Sometimes those things are out of our control. And it is such a fast-paced environment. So no matter where you work in healthcare, I don't think I've ever come across anyone that says, oh, yes, it's a very good pace and we take it easy. I think everyone is busy keeping up with the pace that comes with the work that everyone does in healthcare. Again, no matter where you are in healthcare.
How do you suggest healthcare managers address these challenges? Because they do seem to be very real and very present.
Yeah, I think being aware of these things is important. We are aware, obviously, of all those things we have to do every day, as I said, all those challenges that we have day to day. But I think just taking that time to look at the bigger picture and to make sure that you prioritize, firstly, your development, increase your self-awareness. It's okay to say, oh, do you know what? When I had that conversation with my team member, perhaps I could have done things a little bit differently and maybe have had a different impact or a different outcome. So it's actually kind of spending some time to reflect, increasing your self-awareness, and then adjust your behavior as needed. So no one comes into a management and leadership role knowing what to do every single situation. And so it's that openness to, do you know what, I'll probably have to develop, and it needs to be a priority for me and for the team. So I think that's probably the first thing that people really need to think about it, and be okay to be open, to be vulnerable. Find others who can support you and people who will hold you to account. So whether that's a coach or a mentor, whether that's a colleague, it's finding other people who can support you and who you feel safe talking to. So it's a trusting environment. And I think finally, prioritize the things that make the team successful. So again, we can get caught up in the day-to-day challenges. There's a lot of things to do, and sometimes we're not helping the team focus on the right things. So I think there are a few things that we can do as a manager and leader to really help get the team focused in. Would you like me to share those things?
I would absolutely. I mean, because your team is your team. So, yes, absolutely. How can managers and leaders ensure that success and the optimal performance from the group?
So I like to make things simple so that we can focus, because there are so many things for us to do. So I use a model called Manage, Lead, Succeed. Now, this is a model that I use. The core concepts are the same, whether you like to use a model or a framework to follow, or whether you just really want to take the concepts away. So for me, there are 5 things that we need to be doing as managers and leaders to help our teams be really successful. So the first one is guide. I think the starting point for effective teams is for them to have a common purpose, also a common vision. What does that future look like? What is success for us in the future? And have common goals, shared objectives that are helping us move toward that vision. So our first thing as a manager and leader is to guide them, to be able to set that vision for success for them and clearly communicate that, and make sure that the team are each aligned so that we're working on it together. We're not going off and doing our own things in our own ways. That's number one. We also need to engage the team. So create opportunities for them to build trust with each other. Teams won't work effectively together if they don't have trust with each other. And in healthcare, teamwork is a really important thing. So we need to give them opportunities to build trust. We also need, as managers and leaders, to understand what motivates each of our team, what inspires them to action, what are they interested in, and equally as important, what might demotivate the team or demotivate individuals? Because as much as we can, we need to try and fix those and address those. And it's better that we know these things so that we can actually take action. So that's the second thing. We're going to engage the team. The third thing is to deliver. So we're delivering results. So we help the team do this by setting meaningful milestones. And those milestones relate back to our vision for success. So it all links together. But what are the milestones through the year? And then tracking the progress, celebrating success, and adjusting if there are obstacles along the way. So we've talked about guide, engage, deliver. 2 more areas that I think are really important for us to focus on. Develop. So finding out how your team members like to learn, because we don't all learn the same way, do we? We all learn in different ways. So I think finding out how they like to learn, providing them with those learning opportunities, whether that's going on a training course, whether that's having a mentor, it might be actually in other ways. It might be doing something online. It might actually just be reading. Find out what is the best method for them and provide them with those opportunities. And part of that can actually be delegation. So a lot of managers, particularly when they're new, they love to hang on to all of the things that they feel responsible for, or sometimes it's jobs that they like to do. So we need to remember that delegation, it's not a negative thing, it's a really positive thing. It's a positive thing for us to free up some time, but more importantly, it's a really positive thing for our team because it gives them opportunities to learn and grow. And the last part of develop is not to forget to develop yourself. As I said earlier, really prioritize your development because that's really critical. And we can forget that in the busyness of our day. And the final thing is what I call the magic ingredient, and that's coaching. So across all those 4 previous aspects, what we need to be doing is less tell and more ask. So we're asking some really great coaching questions to involve each of our team members so that they are actually starting to take ownership and becoming more accountable for the work that they do. And in that same process, you're actually developing them because you're stretching their thinking. So the 5 things to help it, I guess, help the team focus and ensure that they're performing: guide, engage, deliver, develop, and coach. It might sound like a lot to remember, yet hopefully that helps us to prioritize those areas when we simplify it down into 5 things.
And these things all are so crucial. And I bet taken together really can bring the team up, elevate. And I know that has to all, when all coming together, morale. And I think that's such an important thing because as you were talking about motivation and what can kind of take that away, I think morale is huge. And if you have a team who is engaged with what they're doing, I think the sky's almost the limit.
Absolutely. And that's our role, to help them engage. And sometimes people get frustrated and say, oh, my team, they're not interested in what we're doing. Well, part of that lands on our shoulders as managers and leaders. And I don't say that to say there's extra pressure there, but that's actually part of our role to help engage them, as you say, to help that morale to build.
Is there anything else that needs to be considered on top of these priorities?
I would say that one of the most important things that we can do when we're doing those 5 things is to be really conscious of psychological safety. Psychological safety is something that's been talked about a lot, but this has been a concept that's been around for years. It's a critical element to a high-performing team. So what we're talking about here is creating an environment where people feel psychologically safe to be the best that they can be in their job. So we need to be thinking about things that are important for the human brain to feel safe. Now, sometimes when I talk with healthcare leaders, they will label team members that they're difficult, they're incompetent, and that's kind of a shame because we're starting with a mindset of seeing our people in a negative light sometimes, because difficult people are actually just people, and there's a reason that those people may be behaving in a way that we deem as difficult. There's a cause for it. Most people don't get up in the morning and say, hey, I'm going to make my manager's life a misery today, or I'm going to not talk nicely to patients. Most people don't get up and make that choice. And I think what we need to be doing as managers and leaders is getting to the bottom of some of that and making it safe for people to actually grow and develop and choose the right behaviours that are not difficult and that are seen as really productive. So I think we need to remember that at the heart of those emotions that we might see in the workplace, and healthcare is a very emotional place from time to time, it can be very stressful. We need to remember that emotions are at the heart of some of these challenges with our team, and the emotions come from our limbic system in the brain. And the reason that it may appear to be challenging is simply that person's brain is trying to keep them safe. So it's triggering an emotion. So that might be a fight, flight, or freeze response. And so there's a lot of instinct that leads to people behaving in perhaps not so productive ways. And that's not to excuse that behavior, but it's for us as leaders to say, how can we make it a bit safer for their brain? So for instance, when we implement change in a team, the human brain doesn't necessarily like change in the first instance because change requires the brain to think and uses a lot of energy, and we're doing something differently. And so therefore the brain goes, hang on a moment, this is a threat. And so it can trigger for someone to behave perhaps what we deem as inappropriately with change. So they might get angry, they might express frustration, they might be very negative, or they might withdraw and not actually implement the change that we're asking. And a lot of that is driven by their non-conscious process trying to keep them safe. Now, we need to help them to be able to discuss what's behind that so that we can address it. So psychological safety is a really important thing for us to think about, and it's not an easy thing to do. Some of the priorities I've spoken about will help with that, particularly coaching. There are lots of other things that we can do to create that psychological safety. I'm not sure how long you have for your listeners, though.
Oh, please share. This is really good information that I think will benefit our listeners tremendously.
So I'd be thinking about these types of things in creating that safe environment for people. The first thing is to look at your own mindset. Am I labeling someone in my team as negative? And if I am, it's taking a deep breath and remembering that they are just people and they're not necessarily trying to be difficult. So we try to stop labeling, we switch our mindset. If people find that really hard to do, I always say, find one thing that you admire in that person, no matter how challenging they might be to work with. And most of us can find one thing with another person, even if it's the color of the shoes that they wear. It doesn't matter. It's just trying to switch our mindset to see them in a more positive light. I'm sure we can find other things apart from the color of their shoes, though. There'll be something, even if it's just that they're so passionate, because sometimes that passion and interest in something can generate a negative behavior. The next thing to think about is, how do we help them see choice in a challenging situation? So if we use, again, change as an example, when we implement change, people often feel like the change is being done to them, that they don't have a choice. They feel like everything is mandated. Yet in most situations, there is some choice. Now, even if that choice is the attitude that they choose to bring to the change, that's a choice. Or more often than not, there is a choice around how people implement the change. There might be certain aspects of a change that you're implementing that people can determine for themselves how they will go, or at the very least, discuss it. So for instance, to help people feel there's a choice, we might say something like, again, using our coaching questions, what do you see as our next steps from here? Or how would you like to implement this? Or it might even be, who do you think we should get involved? Or what concerns do you have about how this will be implemented? Those questions don't say, well, we're not going ahead with a change if they're not happy with the change, but what it's saying is you have a choice here. And those questions help reduce their emotion and get their logical brain thinking so that they're more likely to be involved and take ownership. So helping people see that there is choice doesn't take away all of the fear, using change as the example again, yet it reduces the emotion. So it doesn't take away all the fear, it reduces the emotion that helps them then focus. And probably the third thing to think about here in creating psychological safety is to bring empathy to the table. And it's understanding that people respond in a certain way based on largely their emotions. And so we need to help people feel that we hear them, we understand them. Empathy doesn't mean that we'll say, oh, that's okay, you can behave like that and that's fine.
It gives you an
It's
excuse
more
for bad behavior. We don't want that.
Exactly. Jennifer, you're quite right that they're being heard. That's so important. And You know what? That's what most people just want. They want to feel valued, respected, and it's really just, I hear you. It doesn't mean that's okay, behave badly. It just means I hear you, I understand, what can we do about it? So I think those three things are really critical. Think about your own mindset, help people see there's a choice, and demonstrate empathy. There are other things, but they're probably the critical three to help create that psychological safety.
What pearl of wisdom, what key takeaway would you give to someone who might be new to the management realm or who has just gotten into this position? If you could just give them one key piece of advice, what would you tell that person?
I think if you're new to management and leadership, the one piece of advice that I'd give you is don't be scared of leadership. I often say this to people who come into a new role. There is so much that they're excited about, but with that excitement sometimes comes fear. They start to look around, they start to compare themselves to other managers or other leaders, and they maybe start to do some reading or some training or look at leadership theory. And sometimes that can be very overwhelming. And people can get a bit, I guess, despondent that, oh gosh, I'm never going to be that manager or that leader. So my key piece of advice is don't be scared of leadership. It's really just starting off by being a good person, and that's not that hard for most of us. So it's really focusing in with positive intent, because what will happen in your time as a manager and leader, a lot of what you learn will be through discussing with others, focusing on your development, so doing some training, and also learning on the job. So you're not expected to know everything at once. So dive in, give it a go, be a good person, and you should be off to a really great start.
Thank you so much for joining us today. This has been such an invaluable conversation, and you have provided such fantastic information that I know our listeners will be able to take with them as they embark on leadership roles and management roles. And we really do appreciate your joining us today. Thank you so much.
Jennifer, thanks so much for having me. It was a lot of fun chatting with you, and I wish everyone all the best for their management and leadership. Thanks again.
Thank you. Thank you again for joining us. To subscribe or to listen to additional SMA podcasts, please visit sma.org/podcasts.